Well, now for our special segment, as H1N1 fever is back in the capital, 3 people have died and over 60 have been affected. This according to the government data. Now, the Delhi government has asked 22 hospitals, including 5 private ones, to set up isolation wards for patients who are suffering from this deadly fever. Well, joining us for more and to take all your questions, remember, do call in case you have any queries. We have in studio with us Dr. M Wali, medical consultant. Thank you, sir, for being with us this morning. And lots of people worried over the high incidence, 60 people infected, 3 deaths have taken place. Of course, nothing like it was in 2009 when the first time H1N1 hit the country, when there was panic. I remember you were in studio, and over 1,000 people had died at that time. Well, let's see some of those questions there. Vikas Khanna has asked on Twitter, what are specifically the symptoms and why it happens, what measures people can take to prevent it, and is it a seasonal phenomena?
Well, it has something to do with weather only, and this is an influenza-like illness, and the symptom which I am cautioning people this year is that people catch cold, and the symptom first which appears is vomiting, abdominal pain, followed by running of the nose and sinusitis, then cough starts, then they have chest pain, then they have a pneumonia-like illness, rather influenza-like illness, and this catarrh goes off if it is a mild infection. But in severe cases, the people are hospitalized. Normally, it's as you said initially, it's a seasonal phenomena, but the season has changed actually. This was not the week to have rains and thunderstorms and a snowstorm,
and that has
and something different has happened this year, and that is why we are hearing these deaths, these cases. And in RML Hospital yesterday, it was announced that there were deaths. Yes, you said it, 3 deaths, and the deaths are not primarily because of swine flu. Swine flu is not a fatal illness. It is the complication over and above swine flu, like a patient develops very severe infection, pneumonia, or patient is immunocompromised, or patient is on dialysis.
All right, so we have one caller, Kanika, calling in. To go ahead with your question, Kanika.
Yes, actually I wanted to ask, the swine flu is like H1N1 is going on through the capital and it's increasing. That's what all the news channels say. So I wanted to know, what are you guys doing and how can it be controlled? Because we don't take any, we don't think, at least I don't see any steps going on. It's just like number of people dying. It increases. The number is increasing. Somewhere you have got to stop it now. So how do you intend to do it?
All right, Kanika, thanks so much for that question.
Yeah, she has a very genuine concern.
Do?
Yes. Why not? Well, part of it is done by the government, as you said just now, announced setup of isolation wards. The golden word is distance. Keep distance from a person who is coughing. And again, I remind you, we said all the time, wash your hands when you come home. Frequently wash your hands. Do not shake hand too much. Do not go close to a person who is coughing, and keep hygiene intact. If the hygiene is kept intact, it is the biggest barrier to any spreading illness like this.
And Kanika wants to know what the government is doing now. We do know that the government is trying to create more awareness.
Government has everything. Government has medicines. Government has vaccines.
Yes, so they've asked the health department to upload guidelines and publicize this more and more so that people are more aware.
By now, most people know. We are already sensitized population, so we know what is to be done. What not to be done is like wearing a mask has no value. I mean, I tell to people that this is a small equipment and this is called pulse oximeter. You place the pulse oximeter.
So if you could show that for the camera.
This measures the pulse. Also it measures the saturation. Like in this case, my saturation is 98 on room air. It's a studio air, of course, not too much ventilated. So if this is shown, this is 99 ideal. This is showing the saturation. This is a very good table equipment, can be kept by the doctor. If the saturation in this is low, like 73, 64, then it means send the patient immediately to the hospital, ICU. This is the only thing, very common test, very simple test, which can decide the seriousness, the impact of the illness and the seriousness of the infection. If the saturation falls.
Another Twitter question there by one of our viewers, Swapan Seth wants to know, isn't there a vaccine to prevent it?
Yes, every 2 years we modify the vaccine. And the last vaccine which is available covers fully this H1N1 strain. This is called influenza shot. It should be taken by people who are more susceptible, especially people like us who work in the wards, nurses, paramedics, and very old people. And pregnant ladies can also have it if they have somebody suffering around.
But sir, since 2009, when that big panic took place, when first H1N1 had hit, then we had this
that
vaccine.
Time probably we did not have it
right
ready.
After that, the next year, and then and a lot of people I know personally used to take the vaccine as soon as the season set.
We
in.
were told it will take time. We will import. Government was on its toes.
Right.
So now we are well prepared. You see, it is freely available. The drug which is called.
So should people now, since it's once again come back, should people get themselves vaccinated, get their children vaccinated?
I would not recommend it a universal vaccination. It is let the doctors identify the susceptible group and vaccine them properly. I would not recommend. Nobody would recommend a universal vaccination. It is because everybody doesn't need it. Everybody doesn't need it.
But right now we must be having many parents who are watching right now worried about their children. So
children should not be sent to school. That is the best vaccination for the rest of the class. If my child is coughing and I suspect that he is a febrile illness, I will never send my child to the school. So that is itself a barrier. So every person doesn't need this vaccine. That's very clear, you see.
All right, sir, we're joined by a caller, Mamta Sharma from the capital. Go ahead with your question, Mamta.
Good morning, doctor. I just want to know, I've heard about the vaccine. Is it safe for my child? She is 6 years old.
No need, no need. He has your immunity. I would not recommend. You see, children have good immunity. Yes, children have good immunity. And I have just now said H1N1 is a not fatal illness. So if the illness is mild and it passes off, you see, you have data of very few people. Lot of people might have suffered from H1N1 infection and it might have passed already. So it is only those identified few we know that these have been identified. It's a very mild influenza-like illness. It passes off. It is almost self-limiting. So that's why
no need to panic, no need for these masks the government.
Masks are no good. You see, isolation and distance, washing of hands, hand hygiene, personal hygiene, and keeping the things clean. That's the most important thing. And don't too much hands on the tables, too much shake hand should be avoided.
All right. Well, we have another caller, Sumitra, calling in from Delhi. Go ahead with your question.
Doctor, I just wanted to know if there is a particular age group that is, affected by this kind of flu.
Very young and very old. These are most susceptible groups. People who have bronchitis, bronchiectasis, pregnant mothers, people who have hypertension, diabetes, immunocompromised, people on steroids, or otherwise having immunocompromised state like HIV. All these are most highly susceptible groups and should be taken care of.
All right. The health minister of Delhi has also spoken about this and said basically that initially as soon as you develop the symptoms, you must go for treatment or go to the doctor.
Yes.
And if it's ignored, then those complications can develop.
Obviously. Because you see, I have said just now, when a person catches cold, fever doesn't come immediately. I've been seeing a lot of patients coming with vomiting, chest pain, vague chest pain, which shifts. It is not at one place. And then it is very confusing at that stage initially. And then after 48 hours, fever comes. So, and vomiting, sinusitis like symptoms, running nose. So, these are the symptoms one should watch. If they persist, mind you, this is important. If they persist, you develop cough. And this cough in swine flu is a very, very agonizing, annoying, and it's a metallic type of cough which one can from distance spot. And it's something between the mild cough and what you call kukur khansi, and that's how it is different. So one can identify. By now, all of the doctors are sensitized.
All right, doctor, we have another caller, Deepika, calling in. Go ahead with your question, Deepika.
Hi, I'm Deepika. I would like to know that are swine flu symptoms different from normal human flu?
Very confusing, very
important question.
Yes, she is intelligent. You see, flu is a flu. Swine flu, we say flu-like illness. So it is a very gray area, and it's the wisdom lies in suspecting, you see, and identifying. That's the whole issue. If we ignore, if we neglect, and this tool which I have just now shown helps us. A person who is coughing very violently may have normal saturation, we would say it may not be swine flu. A person who has got mild symptoms, 70 saturation, 65 saturation, immediate ICU. This is a very important tool.
All right. Well, another caller there, Rohit. Go ahead with your question, Rohit.
Good morning, doctor.
Good morning.
Sir, I have just one question. Is there any food which we can avoid during this period?
Okay. Well, food per se has nothing to do with swine flu, but yes, your question is important for your generation. Avoid all cold things, all mixes which you take, ice creams, the cold dishes, and fridge water, I would say, and cold fruits which are refrigerated. So cold, you see, is a provocative factor in the genesis of chest infection.
Especially in this changing season.
Yeah, changing season, you see, we get confused, you see, what to wear. Like I was in a hurry to get ready. In the morning, I was wearing a thermal, and now I'm in a hurry to come to your studio. I even could not wear the banyan. So this is like we move to office like this. It's very natural, you see. Delhi, like city, everybody has got time constraints. So we ignore
must protect
how to
ourselves and be
how
careful.
to dress, protective gear, and never mind. Yeah, never mind if you feel a little warmer inside during the day, because evening when you go home again, you catch cold. And person living in a air conditioned atmosphere which is heated suddenly comes out. From the heated car, one comes out.
Yes.
From the heated bedroom, one goes to the bathroom. That's how I say the biggest, longest walk is for me is from my bedroom to my bathroom.
All right.
Because it is longest because it has to change the temperature.
Right. Well, we also have with us Priyata. Priyata, go ahead with your question.
Hi, doctor. I just wanted to know, a couple of years ago when swine flu had really hit Pune, I had a couple of swine flu-like symptoms, but I got well pretty soon. But I just wanted to know, do I need to take some extra precautions because, am I more susceptible to getting it again? Do I need to take some extra precautions specifically?
This more happens in dengue fever. It does not happen in swine flu that you suffer again, you suffer more. But this question is important for the audience, that we should do good exercise, especially breathing exercises, keep our intake of food regular, keep yourself well hydrated, good amount of protein, keep your immunity intact, and do a lot of exercise. Keep yourself warmed up. That's the message. Keep yourself fit and warmed up.
Okay, and the people who've suffered don't need to take any extra precautions. It doesn't affect.
There are some gharelu nuskhe like taking of saffron, haldi wala doodh, adrak wala chai, all that masala tea these days.
Well, one
very
final
popular.
caller we have, Anisha on the phone line. Anisha, go ahead with your question.
Hi. Okay, I have two very simple questions. The thing is that because of the panic that's around, there's so many different views. So I just want to clarify, can actually H1N1 be prevented with a vaccine? And the second part of my question is, what is the prognosis and actually the complications for patients who get swine flu, which is H1N1?
Well, vaccine, as I said, yes, vaccine is effective. It prevents. Complications do take place because if a person's immunity is low, if he catches a high quantum of infection, if he or she is already suffering from chest diseases, smokers do have more complications. Remember, if they have bronchiectasis, bronchitis, COPD, that's the disease in which we have asthma-like illness. So all these people should be very, very careful. Even a smallest amount of sputum, they should get it cultured. If it is infectious, take antibiotic. That's the precaution. That's a very important question for us also to evaluate the patient. One should be very careful that what we are dealing with is not an infected chest. It should be kept clean, clear, and steam inhalation would help greatly. Rinsing your nose would help greatly. Rinsing your eyes would help greatly. And keep your immunity intact, keep yourself exercising, keep fit, warm, and I assure you, you won't die of swine flu.
All right, Dr. Wali, thank you so much for joining us in studio. And clearly, lots of queries out there. I think the basic point is not to panic, to protect yourself and maintain hygiene.
I must say your callers were very bright.
All right, and do maintain hygiene. Well, that's all the time we have on Breakfast News this morning. Thanks so much for watching.
India's #1 news app. Just got even better. Download NDTV's new app. Fully optimized for retina display. Full screen view. faster response time, and Sudoku. NDTV's new iPad app. Download now.